Let's be honest, for a lot of guys, the word prostate just comes with a side of anxiety, right? It's something we don't talk about much, or maybe we Google it late at night. Well, today, we're going to change that. We're going to decode what's really going on, clear up all the confusion, and give you the essential facts you absolutely need to know. Sound familiar? I bet it does for millions of men. That middle-of-the-night worry, where a weak stream instantly connects to the worst-case scenario. It's a totally common fear, but is it the right one to have? We're about to find out. You see, the prostate is this single, small gland, but it can actually have two very, very different problems. And understanding the difference between them, that's the absolute first step to taking control of your health and, getting rid of that 3 a.m. anxiety. Okay, so first up is something called BPH, Benign Prostatic Hyperplasia. The easiest way to think about it is this. Picture your prostate as a donut. And the urethra, that's the tube you pee through. It goes right through the hole of the donut. Well, with BPH, the donut just gets bigger, and it starts squeezing that hole shut. It's a mechanical problem, simple as that. It's not cancer. But this is what causes all those classic symptoms. The weak stream, the stopping and starting, that annoying feeling that you never quite empty your bladder. Now look at this, because this is probably the most important thing you'll see today. Look at the huge difference in early symptoms. BPH, because it's squeezing that tube, it basically screams for attention with all those bathroom issues. But early-stage prostate cancer, it usually grows on the outer edge of the prostate, way far away from the urethra. So, you know what that means? It's almost always completely silent. This is the key. You cannot, and I mean cannot, use your urinary symptoms as a cancer detector. Feeling fine means absolutely nothing when it comes to early prostate cancer. This brings us to probably the single most dangerous myth in men's health. The idea that having trouble in the bathroom is just a normal part of getting old. Believing this makes guys ignore critical warning signs, not just about their prostate, but about their entire body. And this quote just nails it. That's exactly how you should think about it. Your body is trying to tell you something. These symptoms are like a flare going up, signaling that your body might be dealing with bigger metabolic issues, like high insulin or chronic inflammation. And both of those are major risk factors for much bigger problems down the road, including heart disease. Okay, let's tackle a big internet myth. I'm sure you've seen the headlines, right? Frequent ejaculation prevents cancer. Well, the science shows a link, a correlation, but it's not causation. Think about it. Men who are healthy enough to be more sexually active probably have better diets, better cardiovascular health. Those are the real things protecting them. A healthy sex life is fantastic, for sure, but it's part of a healthy lifestyle, not some kind of magic bullet. And what about all those supplements and herbal teas that claim they can shrink your prostate? Well, listen, while some of them might give you very mild symptom relief, the major clinical studies are clear. They don't actually shrink the prostate. And the real danger here? It's delaying getting effective treatment while your bladder muscle is working overtime, getting weaker, and maybe even suffering permanent damage. And finally, this idea that you can just cut out one single evil ingredient, like seed oils, and you'll be safe from cancer. Look, a healthy, anti-inflammatory diet is absolutely vital. But cancer is incredibly complex. It involves your genetics, your hormones, environmental stuff. Blaming one food group is a huge oversimplification, and it can give you a really dangerous false sense of security. So if you can't rely on your symptoms, and you definitely can't rely on internet myths, then what's the answer? It's proactive, intelligent screening. Let's take a look at how the modern approach to this actually works, because it's not what you might think. This is the number that really matters. 1 in every 8 men will get a prostate cancer diagnosis in their lifetime. That's not a rare disease. This could be your brother, your friend, your coworker. And that is exactly why screening isn't just a good idea, it is absolutely essential. The good news is modern screening isn't about one single scary PSA number anymore. It's a really smart process. It all starts with getting a baseline number in your 40s just to know your starting point. From there, doctors track what's called the velocity. That's how fast the number changes over time. A quick jump is a much bigger red flag than just a single high number. And if there are any concerns, there are advanced tests that can clarify the risk before anyone even thinks about a biopsy. And even if a biopsy is needed, now it can be precisely targeted with an MRI. It's a whole new ballgame. All right, so screening is for detection, but what about prevention? True prostate health isn't about focusing on this one little gland in isolation. It's about understanding how it's connected to your entire body. So the big takeaway here is that your prostate's health really reflects your overall metabolic health. This means managing your blood sugar, because high insulin literally acts like a fertilizer for prostate growth.
It means using nutrients that have real science behind them, like the lycopene you get from cooked tomatoes. It also means balancing your hormones and managing stress, because chronic stress just tanks your immune system's ability to police the body for any rogue cancer cells.
And this philosophy just sums it up perfectly, doesn't it? A proactive, truly preventative approach looks at the whole system. It's all about optimizing the health of the man to ensure the health of the prostate, not the other way around. So, as we wrap this up, what are the most important things to remember? Number 1, urinary symptoms are a check engine light for your overall health. They are not a rite of passage. Number 2, feeling perfectly fine means nothing when it comes to early prostate cancer. And number 3, modern intelligent screening is your single most powerful tool. The only question left is, when was your last checkup? Now, all the incredible insights in this explainer are based on the work of Dr. Ramesh Kumar. He's a board-certified radiation oncologist and a functional medicine expert. So if you want to take a truly proactive approach to your health and really move from just guessing to actually knowing, you can learn more about his practice at LifeWellMD.com, or you can call 561-210-9999.